Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh, Shalom Nama Budaya. Hello everyone, so we are from small group discussion B9 and now we want to present our student project assessment that the title is Non Maleficence Value on Ethical Research of COVID-19 Vaccine. So this is our student group member list and my name is Putu with student ID number 2002511202. So this is the contents. So first we have introduction, and then there's content, and then there's conclusion, and the last one is reference. Start with introduction.
Hello everyone, my name is Anagung Ragujat Kanaparawangsa with student ID number 20025111193. So I will explain about the background of this student project. So COVID-19 is a dangerous disease because the effect is still growing and the victim is keep going around the world. The pandemic is growing higher in Europe more than in Southeast Asia. Like the past pandemic, when COVID-19 emerged, the global community encountered the challenge of developing a vaccine. And then along of the 20th century, vaccines are powerful tool to protect the health of humans from epidemic outbreaks. Whenever one effective vaccine has been successfully developed, a researcher began to trials involving human subject to test and efficiency of other vaccine, and ethical dilemma arise. And the last one, this dilemma causes vaccine hesitancy, where the reason of people hesitate to take vaccine, such as vaccine safety, reduced trust in public health system, misinformation, and etc. This is why it's important to do research on the human subject based on the 4 principles of biomedical ethics. Next. So there's the problem formulation. The first one is what biomedical ethics used in the COVID-19 vaccine research. 2, how the COVID-19 vaccine research use human subjects. And 3, how the non-maleficent value applied to COVID-19 vaccine research. Next.
Okay, so hello, my name is Baruna with student ID 2002511178. So I will explain about the objective and the benefit of this topic. So there are general objective, which is to provide a better understanding of research for COVID-19 vaccines and biomedical ethics used in the research. And there are the specific objective, which is to give information about the use of biomedical ethics used in the COVID-19 vaccines research, such as non-maleficence, beneficence, justice, and autonomy. And there are to inform the readers about how the human subject use for the research of the COVID-19 vaccines. And the last one is to give the information of how the non-maleficent value applied on the research. Next. Okay, so there are, the benefit of this topic is there are practical benefit, which is to give a detailed explanation of the non-maleficence value on the research for COVID-19 vaccines to the medical student, medical lecturer, and or to a wide community. And then there are theoretical benefit, which is to provide information, material in enriching knowledge, especially medical and health knowledge, to wider community. Next.
Hello, my name is Ardisa Pradasuari, and now I will explain about non-maleficence. Every doctor in Indonesia has guidelines in carrying out their medical practice in the Indonesian Medical Code of Ethics, or Kodeki. One of them is not doing harm or non-maleficence, where doctors are expected to work as well as possible without harming the patient. It is expected that infection control can be controlled by referring to a medical code of ethics, which holds the principle of non-maleficence. Thank you.
Okay, my name is Madikina Devrisavita. My student ID is 2002511197, and I want to explain about these benefits of this student project. Beneficence, it means doing good, where this principle applies action that benefit patients and avoid action that harm patients. The agreement on the principle of beneficence is that the best interests of the patient are still more important than self-interest. The most important benefit of research is the increase in knowledge that will impact individual subjects. However, it is even more important if this knowledge can influence a discipline and members of society. Subjects are voluntary, which must be respected, and prohibit implementation that present risks. Next.
My name is Kirana dari Putri, with my student ID number is 2002511168, and now I'm going to explain about justice. So justice is a principle which demands to give treatment equally and fairness for everyone. Healthcare providers must ensure to give fairness to all patients without any discriminations. Justice is an ethical obligation to treat everyone equally with decent morals and getting the rights. Justice and distributed justice needs an equal distributions, including burdens and benefits that will be obtained by the subject of the research. One of the examples is to apply an identical prioritizing scheme for all the patients in the ICU, with or without COVID-19 status, is in terms of fairness and a key to operational efficiency. Justice also means that the participants of the research have the rights to know about potential risks and benefits as well as the information about the results that is gained from the trial. Any publicly funded research results must be shared and disseminated not only to the subjects that participate in the research, but also of all of the society, no matter if the result is not expected. Next.
Okay, thank you. First of all, my name is Putri Padmarini Sari, and my student ID number is 20025111177. So I'll explain about autonomy. So autonomy, based in the Encyclopedia Britannica 2015, comes from Greek, namely autos, which means itself, and nomos, which means law or rule. Autonomy is the authority or the right of oneself to determine the rules that can be used to live one's own life, especially in making decisions. In the medical ethics things, autonomy is ultimately used as the one of the principles of medical ethics in carrying out all activities between doctors and patients. Next. So respecting human autonomy is ultimately made as one of the 4 basic moral or bioethical principles. In medical practice, this basic concept refers to each individual or patients to be treated as a person who has their own autonomy, which has the right to self-determination. In addition, it is also stated that every individual in this case is a patient with an autonomous right. In its application, autonomy has 2 theories, namely liberty or free from the influence of control, and agency or the ability to act as you wish. Namely, conditions deliberately with understanding and without being controlled in determining his actions. In addition, in the applications of autonomy in the doctor-patient relationship is usually associated with telling the truth, respect the privacy of others, protect confidential information, obtain consent for interventions with patients, and when asked, help others make important decisions. That's all from me. Next.
Okay, I will continue the presentation. My name is Herry with student ID number 20025111189. I will continue the presentation about research use human as subject. So we all know that the implementation of research is related to public trust. So it must be carried out based on ethic, trustworthiness, and socially responsible so that the results are valuable. The moral justification of research that use human as its subject is an argument about the social benefits that society gets is greater than its losses. Research using human as subject have several ethics that must be fulfilled that called biomedical research ethic. But before this ethic published, there are several research that not regard to this ethic. That's all from me. And next.
Okay, my name is Nathanael with my student number of 20025112007. I'm going to talk about conducting the research about using human as a subjects. Of course, there are several ethics that must be fulfilled that called biomedical research ethics. Several previous studies with human subjects, but not in accordance with medical ethics, were the TUSG syphilis study, 1932 until 1972, broken Jewish chronic disease in 1933, and research at Willowbrook State Hospital in New York at 1972. This medical ethics deviation has resulted in the formulation of guidelines in conducting research with human as subjects. The history of research ethics then appeared starting with the Nuremberg Code. The Nuremberg Code was created after the German doctor conducted an experiment without giving informed consent and left many of his subjects dead or permanently disabled. The results of the trial then established this Nuremberg Code in 1948, which stated that the voluntary consent of the subject was very important. This document then developed further to produce the Declaration of Helsinki and the Bellman Report. The Declaration of Helsinki in 1964 was established by the World Medical Association to guide doctors in conducting research on humans. Next.
Okay, continuing on, my name is Phoebe, Ezkiella, Nathanael, and my student ID is 200251169, and I'm going to explain about COVID-19 samples. To control the spreading of COVID-19 and support the clinical execution, collection of suitable specimens from a patient that have strong suspicion of COVID-19 infection and accurate laboratory diagnosis of this patient are completely necessary. Thus, an optimal specimen is needed. Since the most common site of viruses are in the upper and lower respiratory tract, the method used for collecting specimens are usually nasopharyngeal swab, sputum collection, and also salivary swab. For lower respiratory tract test, samples can be taken from bronchoalveolar lavage, tracheal aspirate, pleural fluid, and also lung biopsy. Due to having these tests require technical skill and equipment, the specimen is highly limited to patients that show severe symptoms. Sputum is much more common to be collected as lower respiratory specimen. Next.
Hello everyone, my name is Bagus and my number is 200251184. So today I'm going to talk about the issues on COVID-19 research. So scientists in various countries continue to compete, draining many thoughts of racing against time to find a vaccine that can cure COVID-19. The bad news is no one knows when that vaccine will be invented and can be used en masse. Study says that the fastest time is 1 year. However, it is not the only matter of time, but there are some big issues that can keep vaccines from being made. The first one is hoax. Hoax is a popular term that is often used widely to denote false information. This can make people confused in determining the truth of information, namely what is fake and what is not. The presence of false information can create conflict that can hinder vaccinations. The second one is economics. Although the economic shocks caused by the COVID-19 pandemic has gradually subsided in line with the stability of the domestic financial market and the stretching of several economic sectors, however, given the nature of hitting both the supply and the demand side of the economy, recovery efforts will still require more time. The only way to end the pandemic quickly is vaccine. The government must spend how much it costs to mass produce and is distributed to the entire populations. And the government must also think about the economic problem of the country before making the decision to mass produce vaccine, such as whether this vaccine is free or the company need to pay in order to be vaccinated. The third one is ethics. Some ethical consideration that we need to give attention is that not all of the community want to participate in clinical trial. So the engagement should plan long before the clinical trial will be done. We need to do informed consent to the participants so that we will overcome such unexpected ethical problem. We also need to give some compensation to the participants, such as free the charge of their medical bill. We also need to make sure that we didn't potentially harm the participant by doing experiment firstly on animal before giving to human subject. So in making the vaccine, we need to ensure that every people will take equal dosage and the research should avoid being discriminative. After the vaccine is distributed, we need to determine regions and the group of the people have rights to get the vaccine first, and also the government will have difficulty to guarantee the entire population will receive the vaccine. Next.
Okay, my name is Wulansiwi Widiantara with my student ID number is 2002-11173. So in this section, I will explain about non maleficence aspect. So in response of the COVID-19 infection, we need to mitigate the spread of COVID-19. Which one is the COVID-19 vaccine? In the COVID-19 vaccine research process, of course, the implementation cannot be separated from research ethics. The ethical principles of research are needed as a moral basis to guide the action taken in COVID-19 vaccination. Non-maleficence is one of the principles included in research ethics. This principle means that all action on COVID-19 vaccination will not harm the person who will receive the vaccination. Next. In ensuring that the COVID-19 vaccination doesn't cause harm to vaccine receipt, we can put our attention to several things that affect the efficacy of COVID-19 vaccine. Factors that can affect the efficacy of the COVID-19 vaccine include host or human, agent or vaccine, and environment factor. Host or human factors are factors that influence by the condition of the vaccine recipient itself, including genetic factors and characteristic of vaccine recipient, such as age and comorbid factor. Again, our vaccine factors are factors that come from the vaccine itself, such as the type of the vaccine, the composition content inside, the way the vaccine is administered, and how the vaccine works. Meanwhile, environmental factors are factors that influenced by the external condition of an area, such as the transmission of COVID-19 infection between other regions. Next.
Okay, hello everyone. My name is Evangelina Vincent Oetami Lacerda with student ID number 2002511170. So in this moment, I will going to tell you about the conclusion of non-maleficent value on ethical research for COVID-19 vaccine as our student project B9. So the existence of COVID-19 vaccine is a new achievement and hope for the whole world in facing and dealing with the COVID-19 pandemic. But the process that involving human as research subject create ethical dilemma in society. Therefore, 4 research ethic principles are needed as a moral foundation, guideline for action that taken in vaccination against COVID-19. The 4 research ethic principles are respect for autonomy, beneficence, justice, and the most important thing is non-maleficence. Why? Because the safety and feasibility of vaccine can be said to be safe to use if there are no harm or non-maleficent thing in the study subjects. Okay, and that's all the conclusion of our student project B9. Next, the reference will be told by Desita. Thank you.
Okay, so that's all that we can explain about our student project assessment. And this is all the reference that we use to making this student project. And this is two. Okay, last but not least, we hope the student project assessment give you a lot of information and more knowledge. And we close it with thank you.